I'm Dave Mastovich. Cucamonga Valley Medical Group is committed to bringing clarity to the COVID-19 crisis for their patients, families, and the community. With me today are Dr. Rahmi Mowjood, the Chief Executive Officer of Cucamonga Valley Medical Group, and Dr. Kyle Smart, the Chief Medical Officer of Cucamonga Valley Medical Group. Thank you both for helping out and bringing us the information that you do in these videos. Let's start with you, Dr. Smart. There's been some talk, and we're close to where some states are going to reopen here in the United States. With that comes some excitement, but also some anxiety because people just aren't sure what that means. What can you tell us about the states reopening and what it might mean?
I think it's important to remember the overall goal of what we've been doing and why we're even, quote, reopening. So what we've been doing is trying to slow the spread of COVID-19 to a manageable infection rate for our healthcare system. And so as we get to herd immunity of 60%, so we can really get back to normal, we've been trying to flatten the curve and lower our critically ill and death rate, fatality rates. And the strategies have been working. And so not only are some states going to reopen, we've already had examples of this in the world as this COVID pandemic has impacted our planet. Sweden has had a modified strategy this whole time, where they've been doing the whole time what we're talking about doing in a reopening, a strategic, responsible, continued social interaction. They never implemented the quarantine measures that we have. And their infected rate has gone from 10,000 to 20,000 in just under 2 weeks, with a fatality rate of 12%. Worldwide, the fatality rate's about 6 to 7%. And in the States, it's continued to be under that, thankfully, to the measures that we've taken. We saw Japan do really well at the beginning. They jumped right on there with some strong quarantine and social isolation measures. And they did that for about as long as we currently have, about 5 to 6 weeks. And then there was a lot of pressure to reopen. And when they did, what they found was they reopened too soon for their country, and their infection rate spiked back up. And then they had to go back into a full quarantine and social isolation plan. And so now here we have, in our own United States, Georgia has reopened things very strategically since last Friday. And based on what the patterns have shown, by the time the virus gets into somebody and then starts manifesting symptoms, it takes 5 to 14 days. And so we wouldn't expect to see any problems with what Georgia's doing for about 2 weeks. But really what we're seeing in Sweden and in Japan is it takes about 3 weeks to really see if the reopening and the strategic way they're reopening is working or not, or if maybe even Georgia's reopening too soon and we're going to see a spike in infections.
Dr. Mowjood, talk a little bit about when we reopen, what that might mean at the micro level for a small company, so we can extrapolate that to a medium-sized company and big companies. Talk about that for a little bit.
Sure, yeah. So imagine that you work in a company and you've been working remotely, and the green light's given, you can come back, and the essential people that come back, maybe there's 5, maybe there's 10, let's keep it small. If that number can stay controlled, so if you can stay within your work environment 6 feet apart, if you can make sure that you're only going to work and coming back, and that now that you're out and about, you're not splintering off into other places, going and seeing other people, if you can keep that environment extremely controlled, if you can keep your work surfaces cleaned regularly, tabletops, desktops, computer keyboards, handlebars for doors, doorknobs, if those are regularly cleaned, if the surfaces and if the entire workspace and the office space is cleaned regularly on a nightly basis, and you maintain a level of control outside of the office where you are not meeting other people, then you can potentially find a small little haven where you will be okay within that community. Now, the likelihood of that happening, you'll have to ask yourself, and you'll have to see, can we do that? But extrapolate that example to something bigger. Let's say a church or a mosque or a temple. Now you have people that are coming in once a week in a larger number. You're socially distancing everybody 6 feet apart, but then you've got pews that people touch. You've got carpets that people walk on or pray on, prayer books that people handle. How often are those going to be cleaned? How often are the surfaces going to be cleaned? Do you need to have a company come in on a daily basis to deep clean everything? Because now you are introducing people that you have not been able to successfully contact trace. And I'm not saying contact trace healthy people, but unless that group of people can be very specific as to who they're interacting with outside of that group interaction, it's very, very difficult and challenging. So even though the desire is there, and I get it, and even though the want is there, you have to be very, very careful about this idea of reopening into a scenario that was exactly like how it was before, because there's a whole new layer. And in the office example, let's say you do great and everyone is being careful and all the services are clean, and then someone comes in and drops off a package from the outside. Then you got to revisit all of that all over again. Who did that person interact with? What things did they touch? And then you got to go start from beginning all over again.
So what you described, having accompanied myself with that size of company, it would mean that not only do we have to keep an eye on who comes in and out and we have to clean, but you're saying we'd have to be diligent about each of us not being exposed and not going to a happy hour in the neighborhood where people are 6 feet apart, but still everyone's kind of talking and joking, and make sure someone doesn't have a friend come over to the house. Is that what you're saying, that to try to really contain it for a small company, you'd actually have to look at each employee and say, we want to make sure you're diligent about what you're exposed to?
Yeah, I think it's really a question of, if you want to be able to go back and work, then you need to make sure that you're limiting your exposure to keep yourself and everyone else safe. Because you don't know if the other people you are interacting with could potentially be sick, right? We have learned that this virus, there's a long stretch of time where people are asymptomatic, but they are carrying the virus. Unless we get to the point where we can test people regularly, this is how this reality is going to need to look like to be successful.
So Dr. Smart, he's broke down for us the micro level of that example. You started off talking about the big picture and how this has impacted multiple countries. What would you say to the average person there who's thinking right now, I'm excited, we're reopening? What would you say from the standpoint of where this could end up if we aren't still maintaining a lot of things that we're doing today?
So the answer to that question is the fact that there's a lot of people out there that haven't been exposed to COVID-19 personally. They don't know someone who's been sick or critically ill or died from this. And I'm talking about in our country, a majority of people. So there's pockets like New York, and our heart goes out to what we're watching them go through. But most people are getting a little stir crazy 7 weeks into this 12-week quarantine and social isolation and social distancing policies that have been implemented. And what that's doing is negatively reinforcing positive behaviors, meaning because nobody sees anybody sick, they think, oh, they don't attribute it to what we're doing is working. They think it's not as bad as we were told, so let's get back to business as normal. And the danger of reopening without very strict guidelines and criteria and processes in place is that the infections will spike back up and overwhelm our healthcare system and be the worst case scenario that we have seen in some places in the world, including some places in our own country.
It's extremely valuable insight, Dr. Smart, when you describe what is happening, because it's human nature to think and misperceive that, oh, it wasn't as bad as we thought, when the reality is the stuff we're doing is probably working. Dr. Mowjood, let's give you the last word since you've been giving these very specific examples. How would you close this to help bring clarity about reopening the U.S.?
So what I would tell everyone out there and anyone that's watching and has a chance, I would say if you have an opportunity to get back to work, if your state is reopening up, I would caution you to think that it's going to be the way it was before. I would say that you have to be careful. You have to be extra careful, probably more careful and cautious than you maybe even realize you need to be, because the normal now is not the normal we're used to.
Thank you, Dr. Rahmi Mowjood, the Chief Executive Officer of Cucamonga Valley Medical Group, and Dr. Kyle Smart, the Chief Medical Officer at CVMG. And a big thanks to everyone at CVMG for all the hard work the employees and the team are doing. They really do treat everyone like family, and they want this to get out there to patients, employees, the community, to bring clarity to the COVID-19 crisis. More videos to come.